Literacy is the ability of people to access, understand, and use health information. Adults with low health literacy have low reading, numeracy, and digital skills, and often don't have knowledge about how their bodies work, how to access the healthcare system, and why preventive and chronic care self-management is important. Over a third of Americans have low health literacy. Having low health literacy matters because people with low health literacy are unable to read medication and discharge instructions, follow instructions on a prescription bottle, use a table or chart to calculate their insurance deductibles, find accurate health information on the internet, or understand the concept of risk. They're less likely to know about preventive health measures, to manage sick behaviors, to seek health information, and they're more likely to miscommunicate with their health providers. Only 12% of Americans have proficient health literacy. Lower rates of health literacy can affect people regardless of age, race, socioeconomic status, or education. Research tells us that there is a direct association between lower health literacy and poor health outcomes. But health literacy isn't just individual and one-sided. People who provide health information must also make sure that what they provide, things like insurance information, diagnosis and treatment plans, information about preventive measures like flu shots, are accessible, understandable, and usable. Health providers use a lot of jargon and often speak or write in a very direct communication style. It may be hard to understand what the health provider is saying, or what the insurance document says, or what that prescription label is trying to tell you. Communication is a two-way street, and both speaker and listener need to be at the same level for everyone to understand. And then there's also the issue of context. Anyone can have low health literacy depending on the situation. If you're sitting half naked in an exam room, even if you have 3 advanced degrees, you may be anxious, unsure of what your diagnosis is, and maybe also a little afraid to tell the health provider that you don't understand what he or she just said. And finally, health literacy doesn't exist in a vacuum. Individual factors and the socioecological context act together to explain individual health literacy levels. There are individual factors like genetics, biology, language, educational attainment, socioeconomic status, beliefs and values and attitudes, and the experiences that affect how people accumulate and use health information throughout their lives. Interpersonal factors focus on relationships with close others, and that includes family, partners, close friends, and culture, which all have a direct and indirect bearing on how people view health information and practice health behaviors. Community factors include education, employment, healthcare services, and neighborhoods. For example, adults who are employed are more likely to afford insurance and medical care and interact more with the health system. Formal and informal education help increase the acquisition, understanding, and use of health literacy skills. Neighborhoods can also have a big impact on how people can practice their healthcare skills. Is it safe to walk around the block like your doctor said to do? Is there a minute clinic when you have a sore throat and just need to make sure you don't have strep? Is transportation available? And finally, societal factors also play a role in developing health literacy. These include laws, the healthcare system itself, and entrenched disparities. Please read the assigned articles and watch the AMA video. You'll find parts of the video quite revealing and maybe even shocking.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin, because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4, okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule?
One capsule. I don't know what this is. That's
Twice?
Twice daily.
Okay. So
Okay.
so how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure. Okay. But hypertension doesn't mean the same to you.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great! I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?